The attending column is still yellow because I've not co-signed that note. Again, here's the progress reassessment note within ED notes. If I'd like, during the course of that patient, I can continue to add continual updates to the patient. This is also the area where you'll be able to enter radiology findings, EKG findings if you want, and the appropriate consultations that have been made. This may also be an area where you simply put an update for the patient, like tolerating PO, or that the patient has gone to CAT scan or is awaiting a CAT scan. Since this is now a computerized environment, you'll no longer have to document that you've reviewed the labs or that you've reviewed the radiology findings, since you'll be doing that through the whiteboard. However, if you want, you can use this as an area to address things that you've done for the lab findings. For instance, I might write hyperkalemia of 6.1 treated with Caxylate. And I can quickly save those notes as well. What I'm going to do now is I'm going to log off as a resident medicine, and I'm going to go in as an attending. So when I go in and log in, as you can see, my home screen now displays that there's an active patient that I'm signed up for, which is patient checkout, and that there's one action pending. This action is the signing of the note. These features here again, assignments and teams, you can use to quickly view all the patients that are active on your team. So if I was to click Team 1, I would notice all the patients populate there, and I could quickly enter their chart through here. I'm going to go back into patient checkout. You can see that the attending screen is exactly like the resident screen. The ED notes are here. I'm going to briefly launch the whiteboard so that you can see the updates as I make them as an attending. Here's our patient checkout. The resident note, initial note has been completed. It's pending the attending note. As I come into the patient, as the attending, you will need to edit any note or sign them by going to Note Edit Correction. If you are a resident and wanted to make additions or changes to your initial note, you can also do them here. Again, the optimal workflow is to write your initial note and make any additions or subtractions using the progress reassessment note. But if you need to edit or correct a previous note, you can go here. Again, as the attending, you'll be entering the Note Edit Correct section to sign the resident note. As you can see here, the only note visible is the ED provider initial note, which is unverified, meaning it's not been signed by the attending. I'm going to enter the note by double-clicking, and you can see that the note auto-populates all the fields for the attending with the resident note. I click Document, and you'll see that the attending attestation field now opens up within the note. Given that everyone's workflow is different, you can populate this field with any of the choices that you normally do. You can say, patient seen and examined by me, and I completely agree with the resident procedure and haven't made any changes. You can click number 2, which is I agree, I've seen the patient and I agree with the resident assessment and plan, except for the following changes, and you can enter changes here as below. Or you can say, patient seen and examined by me, and I've reviewed and edited the resident's note. When you do that, you can actually go into the resident note and make any changes. If I'm not happy with anything that I see here, I can enter it and make the changes as above, or additions. I can save that as well. And now you'll notice that the only area that I've made changes is bolded, and the other areas that I've not made edits to are blue. Keep in mind that the computer will still save two versions of this copy. One is the original resident note, and one is the note with the attending changes. The note of record will be the most updated note. So now when I continue and hit accept, you'll notice that the whiteboard updates to show me that the resident note has been signed. The resident note has now been signed. That is the only hard stop within the computer. As I continue to care for the patient, I'm going to continue to make progress reassessments through here. I can look at their labs and results through here. And when I'm ready to disposition the patient, I'm going to go to the dispo note. As you'll notice that the admission order has now been deleted from the patient shortcuts. That's because every disposition is now included within the disposition note. When I click dispo note, you'll see that all the appropriate dispositions are located here. Depending upon which one I select, the computer will ask me to enter different information into different fields. Since we're all used to using the admission order, I'm going to show you how to use the discharge note. Let's say at this point I've already realized the patient has a pneumonia and I think that they're stable for discharge. I'm going to order them a prescription like I normally do using the prescription entry shortcut on the patient shortcut menu. I'm going to order them moxifloxacin. I'm going to give them a standard prescription without any refills, and this will print at the computer nearest, or at the printer nearest you. Now when I'm ready to discharge the patient, I'm going to click a disposition note. I'm going to select discharged. The time, again I can use N as now for shortcut. Now it'll ask you for the problem list again. Here our expectation is that you enter the appropriate impression or preliminary diagnosis for the patient. The reason for this is, one, for billing and coding purposes, and two, because the impression or preliminary diagnosis will be printed on the patient's discharge instructions. I'm going to say add problem. Bacteria pneumonia, acute, and I'm going to say that this is a impression, a preliminary diagnosis. The next field is secondary diagnoses. Quite often we address multiple problems for a patient during their visit, and we should take credit for that. Maybe I address their hypertension and their hyperglycemia, so I'm going to take credit for it here. There's a procedure column which is optional. It lets you go in and take credit for any procedures that you've done. This is where you would document critical care time, bedside fast, or any other procedure that's been performed. If you don't see it here, all the way at the bottom is also other, or no procedure performed. Very soon, one of the new CMS measures is going to require that any procedure performed on a patient be printed on their discharge instructions. So please keep in mind that we hope that you will be using this field to enter any appropriate procedures. I'm going to say that no procedure was performed. As you can see, the next field, discharge prescriptions, has automatically populated from the prescription that I had entered for the patient. I'll also do focused medication reconciliation by saying I have not made changes to their current medications. I will give my impression of their condition on discharge. And then here I can enter any other summary comments I would like, or any specific instructions I would like for the patient. If I have none, I can click through them. Now, one of the unique features of this new dispo note will be my ability to give instructions and hand off to the discharge center for patients that are headed there. For this patient, I'm going to say no, they're not going to the discharge center, and it next asks me for their appropriate follow-up. I can choose anything like I normally do, and as you can notice that there are fields within here that will auto-populate. If I pick a 1-week appointment, it will print red card on their discharge instructions so that when they call back the operator, they will know that they were issued a red card, or the clinics will know that they were issued a red card, as we do now. If I click 3 to 4 weeks, it will actually only give a number for the patient to call back to make their appointment. I'm going to say medicine. And again, keep in mind that since all the documentation will now be within QuadraMed, you'll no longer have to do the other contact note for patients that are receiving 1-week appointments. It then asks you to fill the discharge center report language, which is English or Spanish. This is asking you how you're going to want the discharge paper to print out for the patient. This is going to be in substitute for the hard white copy of the chart that we normally hand the patient. So you can only pick English or Spanish. And then it asks you whether you want to take the patient off the whiteboard at this point, or if you want to leave them on the whiteboard. For the general emergency department, this is going to mean that we say the patient left the ED. However, if you're in the pediatric emergency department, this may mean that you leave the patient on the whiteboard so that the nurse can discharge the patient for you. The last field that it asks you for is medical decision making, and it lets you take credit for the things that you've done during the patient's visits. Whether you reviewed their radiology independently, made an interpretation of their EKG or SAT tracing, or you discussed their care with a regular provider or with a consultant. It lets you take credit for those. I'm going to go back here just for the purposes of demonstration and show you what happens if you had selected that the patient was going to the discharge center. And continue editing, go to the discharge center and say yes. As you can see, a new field opened up which assigns the team to the discharge center. This means that when you click enter here, the patient's going to fall off of your whiteboard and enter the whiteboard for the discharge center. The additional field that opens up is instructions for RN. This lets me give the discharge center staff a written handoff for what to do to the patient when they arrive in the discharge center. For instance, here I might write, please follow up the x-ray, and if negative, give micromedics instructions for viral syndrome. Or this may be where you enter, please give crutch walking demonstration, or please recheck a finger stick. Whatever you would like the discharge center nurse to do, this is where you would write it. When I click accept, the patient pops off of our whiteboard and goes to the discharge center, and you'll notice this update here. The patient disposition has been changed to discharge home, and you can also see that their location is now entered as discharge center. Since my whiteboard is showing me all the teams right now, it hasn't fallen off my whiteboard. It's showing me that this patient is now on the discharge center whiteboard.